On 17 May 2013, the Health Quality and Safety Commission launched a national patient safety campaign, Open for Better Care. The campaign aims to reduce harm caused by falls, surgery, healthcare-associated infections and medication. The campaign is being coordinated nationally by the Commission and implemented regionally by the health sector.
Greetings everyone and welcome to the Open campaign. Someone said to me the other day, why are you running a campaign? We're already working in patient safety in our wards, in our hospitals, in our communities. Is a campaign necessary? Well, that's a really good question. I think there are lots of good things happening in the health service. A lot of people are very focused on patient safety and improving quality. There's lots of quality improvement happening, and when I talk with people, I'm very impressed with how focused people are on this issue. However, we still have quite a lot of harm happening. People are entering our hospitals and inadvertently falling over and having significant injury. There are infection rates that could be better. There are consequences of surgery that should not be happening. Lots of medication errors are still happening, we know, right across the health system. I think we could do a lot better, and this campaign is really a way of bringing some energy and zest and freshness to the whole patient safety issue. It's interesting, when you work in health, you always think that health is unique and you're the only industry or the only service that's experiencing some of these problems. In fact, we know that all kinds of industries have challenges around quality improvement and safety. The airline industry is kind of a classic, and we have already learnt quite a lot from the airline industry about teamwork and safety.
I've been involved in aviation for 30 years and I've been involved with the health system for the last 5 years. So thinking about some of the things that are parallels between the two organisations, the aviation community relies very, very heavily on individuals acting in teams, working together in concert and understanding their jobs really well to be able to ensure the safety of the travelling public. Healthcare professionals are really have the same challenges facing them. They have discrete teams that are very well trained. Those teams have to come together, especially in times of crisis and trauma, to be able to give the best possible care to people who come in the door of the hospital. I think that's critical. I think it's the teamwork issue is a critical thing for both organisations.
And we know that that's so in just about every aspect of healthcare now. It's the team working together and their sharing of their knowledge and their sharing of their discussions and their partnership with the patient that makes a difference.
There are a whole lot of elements that you have to bring together to try and provide a safe environment. And we're talking about a safe environment for people at work. We're talking about a safe environment for people who are recipients of the system, travellers in aviation, patients in medicine. And so the thinking at the moment is that the safety system has three core elements. One is around just culture, how you treat a person who makes a normal human mistake inside the system. One of them is about reporting, which is how you make it safe and open and easy for people to report things that they think may be creating an adverse event or may have the possibility to create an adverse event. And then the third key element of the triangle is that the organisation is able to learn. It's able to learn from the reports it receives from its people. It's able to change the way it does business, and it's able to make the whole system safer. Safer for the participants in the system, safer for the people who use the system. Fortunately, humans make mistakes, they make errors, and that enables us to learn, and that enables us to grow our knowledge. If we didn't make mistakes, we wouldn't have that opportunity.
And I think that's the most important thing about being open, is being open to talking about the things that go wrong, because it's a human system and human beings do make mistakes inadvertently for all kinds of reasons. And to be open and to discuss that and to learn from them is really a really important aspect of teamwork and of culture building within the health system.
Many years ago, we used to think pilots were bad people, they caused aircraft crashes. The term pilot error pops up all the time, everywhere. Some time ago, we introduced the black boxes, the data recorders and the voice recorders into aeroplanes, and we started to realise that there were things happening in the aircraft that proved to us that either the pilots didn't have good training to be able to cope with the situation, they didn't have the skills to be able to cope with the situation, or the system itself, the way the aircraft was designed or the way it was working, let them down. That's enabled us to provide training, make the pilots safer, give them better expertise, give them knowledge, make the aeroplanes safer. So from my perspective, that means for me now as a commercial pilot, you get a free ride if you're coming with me, because I'm going to get there safely. And all of the things that have happened in the past, all the learnings from errors and mistakes have helped me do that job better. I think the same thing applies to medicine. The opportunity to learn from the mistakes, from the errors that happen in medicine, to make the system safer, to make the environment safer, to make the procedures better and protect the people is what we need to do.
Good teams don't just happen by themselves. They need leaders who will stand up and set guidance and take responsibility and help a team knit together and allow people to talk about things that have happened, all the good things as well as some of the inadvertent errors, and learn from them and learn how to move forward.
Leadership and having a leader plays a critical role in improving safety. But having a leader there and being a leader imposes some critical requirements on that person. They have to ensure that good communication is happening. They have to make it safe for people to communicate. They have to listen. They have to listen to the ideas that people in the team are putting up, because that one person in the team, the most junior person, may actually have the cue and the key to the situation. And then lastly, they have to put a plan in place, and they need to make sure that every single person in the team understands the plan, knows what's planned, so that they can see then if the actions of the team are deviating from that plan and hold their hand up and say, whoa, hang on a minute, that's not what we planned to do, something's changed here, what's going on?
We're really excited about working with you through this campaign, which will be running for a while, and we'll be working on a number of program areas with you. It's going to be energising, it's going to be challenging. We're going to have lots of argument and discussion, I think, as we go along, and maybe we will change some things, but we're really looking forward to engaging with you over the next few years.